Here are my most frequently asked questions on Botox. So what is Botox? Botox is a brand of botulinum toxin A, and there are a few different brands. There's brands like Azelor, Bocutor, Botox, which we all know, Dysport and Xeomin. There's no clinical studies to prove that one brand is better than another, but many doctors favour their own brands for various different reasons. Some might feel one brand might last a bit longer, others might feel that results from one particular brand might be more predictable than another brand. Essentially, there's no one single brand is better than another. But for the purposes of this video, I will refer to botulinum toxin A as Botox because that's what everybody knows and is familiar with. So, how was it discovered? In the 1970s, a psychiatrist was treating a twitch around an eye and discovered that not only did the twitch resolve with Botox, but the wrinkles around the eyes also resolved. So therefore, a cosmetic use for Botox was discovered. So what are the risks with Botox? One of the risks of Botox is that the Botox could migrate into adjacent muscles and therefore make those muscles weaker. So for example, if you had your forehead treated and if you were unlucky that the Botox might migrate into an adjacent muscle group, for example the eyebrows might droop. This is called brow ptosis, but this is easily reversed. What you do is get a single unit of Botox on either side of the forehead high up, and that will resolve it. In the event that you have Botox done around the eye area and the Botox might seep into the eyelid muscle, that muscle could droop as well, and that's called eyelid ptosis. This also can resolve within about 5 weeks all by itself, or you can have eye drops that will help to resolve it too. Other risks include, for example, if you had one muscle group treated and another area not treated, the untreated area might become overactive and the muscle group could protrude a little bit. This is called hypertrophy of adjacent muscles, untreated muscles. It's basically where the muscles that aren't treated will overcompensate for the muscles that are treated. And in this instance, what happens is you just Botox this area that's not treated and it'll resolve that issue. So all of those three potential risks are reversible. An unwanted side effect, but it's not necessarily a risk, is bruising. So essentially, because a needle is used to inject the Botox, well then the needle could pierce a blood vessel on the way in. So there's a potential there for a bruise. And it's basically pot luck if you get a bruise or not. But expect a bruise, and if you don't get one, well then you're just lucky. There are some measures that you can take to help to minimise your risk of bruising, and that would be to cease taking blood thinning medication and cease taking supplements and vitamins that also thin the blood. So blood thinning medication would include the likes of aspirin and non-steroidal anti-inflammatory drugs and anticoagulants. And then supplements and vitamins that thin the blood will be the likes of vitamin E, ginkgo biloba, ginseng, and the likes of fish oil capsules. And also drinking green tea could also thin the blood and make you more prone to bruising. So cease taking those for 1 week before your Botox treatment, and also take arnica homeopathic supplements for about 1 week before and 1 week after. And those factors can help to mitigate the risk of a bruise. How quickly do the results of Botox begin to set in? Usually it begins to start to take place 2 to 4 days later. Full results are seen usually 7 to 14 days later. The longevity of the results of Botox tend to last about 3 months. Clients that tend to have Botox on a repeated, consistent basis, perhaps over a span of about a year, will tend to get longer out of their Botox. They can get 4 to 6 months out of their Botox because the muscles are beginning to relax and become less folded and wrinkled. You may have heard the term of baby Botox. Well, this is just a lower dose of Botox just to relax and reduce the muscle movement without freezing it fully. And this gives you a refreshed, less tired appearance. It's more popular now to administer Botox in a more relaxed, natural way. What areas can be treated with Botox? Well, the classic most popular areas will be the forehead area for the horizontal wrinkles that appear from raising the eyebrows. The frown lines here between the eyebrows, those are also very popular because they make you look very cross looking. The crow's feet around the eyes, they can be Botoxed. The bunny lines, when you squint your nose like that, you can treat the bunny lines with Botox. Those are the most common areas, the upper face. The lower face is less common to have treated, but it can be also treated with Botox. You can treat the upper lip smoker's lines with Botox. You can treat the jawline if you want a more slimline appearance on the jaw. You can treat the cords here on the neck. They're called platysmal cords, and they can be relaxed with Botox as well. But it's more popular to have the lower face treated with skin booster injections, PDO threads, or for example, dermal fillers. It's less common to have Botox done in those areas. Body areas that can be treated for the likes of sweating would be the palms of the hands, the soles of the feet, and the underarms. And that can be very useful for anyone that suffers from excessive sweating, known as hyperhidrosis. Botox can also be used for anyone that has excessive show of the gums when they smile, and that's very popular and very effective. If you happen to have deep wrinkles on your forehead, one session of Botox won't get rid of the deep wrinkles. It will soften the wrinkles that's there, and over time, if you consistently repeat your Botox every 4 months for probably about a year, the wrinkles on your forehead will eventually unfold and be less deep and possibly disappear, but they won't be fully gone in one single go. Just over time, they will disappear gradually from repeated treatments. What pre-op advice would I give you before you come to the clinic? It's best to arrive to the clinic without makeup on, because if we have to cleanse your makeup off before you have the Botox done, the cleansing action can drain the blood from your veins, leaving your veins less visible. That means we can't avoid the veins when we're injecting them with the Botox, and therefore you will be more prone to bruising. So it's essential that you arrive to the clinic without makeup on if you want to avoid bruises. What things should you consider before having Botox done for the first time? Well, Botox comes from albumin, which is a human blood product. Whilst it's screened for all known pathogens, there is a possibility that there could be unknown pathogens that we haven't discovered yet, and therefore down the line we might discover something that hasn't been screened out. So that's something to be considered. Is Botox safe during pregnancy? Well, although Botox is on the market for over 50 years, there's never been any studies of pregnant women having Botox done. So, in the absence of safety data, Botox is contraindicated for pregnant women. That's why I find it so strange that the most recently discovered and manufactured vaccines are purportedly and advertised as safe for pregnant women. It doesn't bear thinking about. So in essence, Botox will relax your muscles and inhibit expression lines. So it'll soften wrinkles, but it might not completely eradicate them. But it will give you a refreshed, less tired appearance. The results are pretty instant. They occur 7 to 14 days after the treatment, and they last about 3 to 4 months approximately. If you have Botox done consistently over the course of about a year on a repeated basis, you'll tend to get longer out of your Botox, probably 4 to 6 months out of your Botox. Call my skin clinic if you want to book in for your Botox treatment.